Good morning. It's good to see you. Thank you very much for making time for us right here on My Doctor. We apologize for starting a little bit late, but here we are. We're live. So thank you very much once again for tuning in. My name is Winnie Lubambe. It's a brand new day and a brand new week. So I believe that you've started on a good note. Now, today we'll be focusing on tapeworms. And I know most of us, when we were growing up, we had some instances of, tapeworms here and there and other forms of worms, that we had when we were growing up, ringworms and all that. So today we want to talk about tapeworms. And probably most of you will be like, okay, really, what is it about tapeworms that we need to talk about? Well, it has become a major concern for the WHO, especially when it comes to the type of tapeworm from the pigs, which of course some instances may actually end up causing severe complications, and one of them of course being epilepsy. So we want to focus on the same, what is it about tapeworms that we as a society need to know and watch about, some of the symptoms, the risk factors, and generally how does it come about, because I found some really interesting facts about tapeworms that they can really grow long. All right, and long, by long I'm talking about like 30 or actually 80 feet. So yeah, so stick around until the end of the show for that and much more. But if you have any other question in relation to the topic today, then feel free. Like I said, we are live, so call in 0791-478-990, or better yet, send us a text message on 40920 with your question, and of course we'll be more than glad to answer all your questions as far as tapeworms is concerned. And of course my guest is here ready to answer again all your questions and give us all the info we need to have as far as tapeworms are concerned. He is not new, but just in case you're tuning in today for the very first time, let me give him a chance to just say hello to the people. Good morning.
Hello, good morning.
You're well?
I'm well.
Thank you very much for making time for us today.
Thank you.
So before we get into all matters tapeworms, can you introduce yourself?
Thank you so much, Winnie, for this opportunity. My name is Dr. John Mureithi. I'm a medical officer, a medical doctor at Sierra Level 4 Hospital in Ebru County. I also work with Medisport Health Limited, where we deal with health information, health training, health education, and matters concerning preventive health care, and also medical and laboratory supplies. All right. It's my pleasure to be here today.
And we're happy to have you as well.
Thank you so much.
Now, like I said, when we were growing up, of course, we had instances of tapeworms. For us, we used to see our neighbors actually with some long things, and we didn't understand at the time what it was. Yes. And the memories that I have is they were really scary to look at.
Yes.
And to just imagine that these things actually coming out from
a
child's body,
yes.
it's just really scary. So let's just focus on the same today. And from the fact that it grows like really long.
Yes.
How long? Because mine, I actually saw like 80 feet. So can it even grow longer?
Yes. 80 feet, that translates to about 15 to 20 meters there.
Yes.
Yeah, because actually there are some which to some extent they can even grow as long as 30 meters.
Yes.
30 meters.
That is so long.
Yeah, it can be so long. But then of course there are those which can be as short as 2 meters or even less, depending on the subtype of the tapeworm.
Of the tapeworm.
Yes.
All right, and of course we'll also be focusing more on the same, but let's just go back to the basics, the tapeworm. Just to remind us, what exactly is it? How does it look like?
Now, I think I would start with the classification for our viewers to understand what exactly is a tapeworm. Okay. Number one, as you remember, we talked about there could be bacteria, parasites, fungi, and viruses. Now, tapeworm is a parasite. Okay. Parasites are now classified into ectoparasites, which now dwell outside the lice, the fleas, and then you have now the endo. Endo is inside. The endoparasites. All right. Now the endoparasites, now we have now some classifications whereby we have now those which are macroscopic and those which are microscopic. Those you can see with your naked eyes, and those now which you can't be able to view. You have to use a microscope. All right. Tapeworm, as you said, is long enough, so you don't have to use a microscope. Yeah. So now those ones, the macroparasites, we have now those ones which are flat, round, and those which are short. Round, now we have now the usual mignon, which people call mignon, the roundworms. Now, then there are the flatworms. Flatworms now, in medical terms, is platyhelminthes. Okay. Okay. All right. Okay. So now flatworms now we have now the flukes and the tapeworms. All right. So, and these are different because talking about the flukes, I've seen some of the medications on the
cover, like on the box,
Yes.
there's written flukes. So I think most of us tend to think, oh, well, this is just, you know, the usual roundworms.
Yeah,
but
it's
they're
true.
different.
Yeah, they're different.
Okay.
It's only that some drugs, they have activity against both tapeworms and flukes. So you
okay.
can actually use for both conditions.
All right.
Yeah.
Okay. And of course, we'll talk about the
Yes,
treatments
yeah,
and all that. Okay. Now, now that you've mentioned the different, of course, types and the different in terms of their appearances,
Yes.
Does this have an impact on sort of like the amount of infection it can cause?
Yes.
And or how probably the appearance sort of helps it to sit in the body, whatever part of the organ they decide to attach itself to.
Yes.
And then again, in terms of the size as well, does this increase like the chances of a complication?
Yes, of course, the more they are, and of course, the larger it is, the more the complications.
Sure.
Remember, it's a parasite, so it feeds. It feeds on the body and what the body produces. So if you have like one which now attaches to the body, then you add 2, 3, 20. So you can just imagine.
Yeah.
So the more they are,
Yes.
the more the complications,
Okay.
and the more severe the infection.
The infection.
Yeah.
All right. And just again, can one have all of the above? The tapeworm, the roundworm.
Yeah.
Can one have all of those?
It happens.
It happens.
It happens.
Okay.
Of course, looking at the risk factors which lead to the infection, you can never say never.
True.
In the medical field, you can never say never. You can have a combination or just one.
Yeah.
Yeah.
All right. Now, so can we talk about now today we're focusing, of course, on the tapeworm, but if time allows, we can also talk about the others. Is it life-threatening? I know we talked about the complications in some rare cases, but is it as life-threatening as, let's say, any other infection, probably from a virus or something else?
Yes, it depends.
Right.
There's something I wanted to finish on the classification, because when you now talk about tapeworms, we have many subtypes, but two main ones.
Two main ones, okay.
One of them is now the beef tapeworm and the pork tapeworm. So pork tapeworm has more life-threatening complications. Like we're going to see later, it goes into the body, goes to the brain, and then grows there. Now brings seizures, and then now the patient can even die.
Yeah.
Now the beef tapeworm usually doesn't have as much severe as effects as the pork tapeworm.
Okay.
But of course, the more they are,
Again.
and the more it's now having effect on the body, it can reach a point whereby now maybe it's sucking blood, the patient becomes anemic. Then sometimes there's what we call bacterial superinfection, such complications. They can be life-threatening also.
Okay. All right. Now, so back to the basics. So how do you get tapeworms? Because most of the time, like I said, and first of all, before we even talk about how do you get it, how common is it? Because I remember when we were growing up, there are a lot of cases of
Yes,
tapeworms, you know, back then. But right now, we don't really hear much about it. So is it still as common as it was, or the numbers have reduced?
Yeah, over the years, we have seen actually a reduction in the cases which present to us.
Okay.
Because, you know, before, like 10, 20 years ago, people did not have good practices.
Yes.
Of how they handle meat. Yeah. But nowadays people are now more educated, because if you find even the literacy levels, they have actually increased. So now people are more informed, because pork tapeworm, of course, it is consumption of infected pork. Yeah. And beef tapeworm, it's due to the consumption of
beef.
Infected beef. Infected beef. So you find that because now at least you have an improvement of how people cook their meat, is a reduction. Then number two, also you find that the involvement of the veterinary services nowadays is more and better than some years back.
True.
So you find that if you combine that, you find the cases are few. But still in Kenya and in an African setting, you find still there will be cases which will present.
Yeah. Okay. Now, so how do you get it? I know of course, we've talked about the aspect of you get it once you ingest infected Bottom
Yes.
line is infected, because when we say, when you take beef or pork, then
Yes.
people will be like, so we stop taking beef or we stop taking pork. Yeah, but
Not really.
infected, all right? So how is it then that some people probably might take, let's say, beef and then not to get tapeworms? Others would take either pork or fish, because also so those, and there's another
Yes.
one on fish,
On
which
fish.
I think we'll also talk about.
Yeah.
So in terms of then, how do you get it? Yes, the bottom line is the infection. I mean, the infected part. So again, how does let's say, for instance, beef or pork or fish actually get infected with this tapeworm, so that when we ingest, we get it?
Wow. It's a good question and a very interesting one, because, you know, it's a parasite.
Yeah.
And, you know, a parasite has to depend on a host.
Yeah.
It can't grow on its own. So usually what happens is, I'll give you a life cycle.
All right.
Yeah. Sometimes there could be the grains in the environment, the plants which animals eat. They have been maybe infected by a previous, maybe, let's say, like in those areas where people sometimes they don't observe good hygiene. Then they go, the way they dispose their waste is really a risk factor.
Yeah.
So talking about, let's say, beef tapeworm, for example, the cow is going to go and feed on the leaves,
Sure.
which are infected
All
with
right.
the eggs.
All right.
All right. Then they now will go now to the abdomen, the intestines of the cow. Then it's not going to grow.
Okay.
Okay, it's going to grow to a stage whereby it's called now the oncosphere, whereby now after the animal has swallowed, it now penetrates and now gets into the muscle. Yeah, mostly the skeletal muscle, the one the animal uses to move.
Yeah,
okay?
and the parts that we love the most.
Yeah, the red part.
Yes.
Yeah, so when you now go to the butcher now and then you get a cut of the meat, you know, ingest now that oncosphere. It is a part of the life cycle of the tapeworm.
Okay.
So in this case, the cow acts as what we call an intermediary host.
Okay.
There's a host, but not the definitive, the final host. So it's the intermediary host.
Okay.
Then now, a person now goes and feeds on the meat, okay? Whereby now it now goes into the intestines and now matures into now the mature tapeworm now.
Okay. All right.
After it now matures to adult stage, it now starts now growing into now those they are called the tapes themselves.
All right. Okay.
I'm looking at they are called the proglottids
Yeah.
in medical terms.
Okay.
but now they keep growing.
Okay.
And what happens is that I'm going to use like a scenario of a sugar cane.
Okay.
Whereby now a sugar cane has like
Has like sort of like, do you call them compartments or those things?
segments.
Yeah. Segments. Yes. Segment is actually the right
So
word. Yes.
it has segments. These segments now are able now to develop eggs inside.
Okay.
All right. So even when the patient starts passing stool with segments, they already have multiple eggs
in them.
And actually, there are millions of eggs. You find some of them even go even up to 40 million eggs
In one segment.
per segment.
Wow.
Per segment. So now they pass through with the segments. All right. Then on the other side, now the animal is feeding on the leaves. In the body, the head, it has a head which has suckers and some teeth. So it is going now to attach itself into the intestines.
All right.
And now start now sucking blood and of course sucking nutrients. You're feeding on food food.
But you do not get the nutrients.
Yes, someone else.
Yeah. Okay. Now this makes sense. Is this why we hear most people say, "Mi nakula na chakula"? Wait, how do people put this? Like unakula lakini ni minyo ina feed on it, and then you don't get the nutrients that
it's feeding.
that you
It's
get.
feeding.
Yes. Yeah.
And actually, you're going to see later that you feed, but you lose weight.
Yes.
Yes.
So that is one of the symptoms that, of
Yes.
course, we'll look at later on.
Mm.
Okay, so you've of course talked about the beef. So is it the cycle the same as the pork and the fish?
Yeah, it's similar.
All right.
The pork tapeworm, of course, is when now the person now eats now ingested pork meat.
Infected.
The infected pork meat. All right. But now what happens is that when now this oncosphere gets into the intestines, now it now tends now to enter into the lining, get into the bloodstream, and now it can now migrate to other parts of the body.
Okay.
And commonly what you see in hospital, they usually migrate and then they go now to the brain. Yes.
Okay.
Yes.
How quickly does it get to the brain? And yeah, how quickly does it get itself into the brain once it's in the body and attaches itself to the intestine and then find its way up to the brain? How quickly does that happen?
Oh, yeah, okay. It's there's no constant number of days, because remember, you might ingest, then it doesn't migrate. All right. So it's by chance. If it happens now to migrate, of course, it's going to get there as soon as the blood gets there. Remember now the blood flow. The blood now from the veins go to the heart, to the lungs, then back to the heart, then to the brain. All right. So now when it now gets now to the brain, what matters is now the time which it will take now to grow to a size which can now cause symptoms.
Okay.
Yes.
All right. And then, of course, we'll talk about the symptoms
Yeah.
a little bit later. But then again, so we've talked about a person taking infected either beef, pork, or fish.
Yes.
But now, can one get tapeworms from a person who prepares the food? And of course, do not, maintain or observe hygiene.
Okay, you may not get from the person per se,
All right.
because if you look at the life cycle, you now have to take the meat that has been infected.
Yeah.
All right?
Okay.
And you have to take it in a stage in which it will be able to grow in your body. If you take,
because they can't survive outside.
yes, they cannot survive. If you take like maybe leaves like sukuma wiki, maybe, and the greens which you usually take, in the stage, at the egg stage, it will not be able to grow.
Okay. But what about if the person is infected? They already have the tapeworms
No.
inside of them, and then they don't observe hygiene. You can't?
Those people, assume they're infected, and maybe they pass the segments which you described in
yes.
stool. You're going to find that the segments, you say, they contain eggs.
Yes.
All right?
Yeah.
And the eggs will not be able now to grow. To grow inside your body. So suppose accidentally you get into contact with now the infected person, it will not grow. It's hard.
Okay.
Yeah.
All right. And what about the soil? And I'm asking this because most of the time, again, when we were younger, we used to take soil.
Yes.
I think even children nowadays do that, but yeah, them is sort of sophisticated in a way.
Yes.
But yeah, and most of us we were told, utapata minyo. Yeah, so that, and then of course referring to the roundworms.
The roundworms.
Yes.
Yeah.
But what about the tapeworms?
It's hard.
It's hard.
It's hard.
Okay.
Of course, we don't say never.
Yeah.
In the medical field.
Yes.
But it's rare.
Okay.
Extremely rare. Because you have to understand the life cycle.
The life cycle. All right.
Of this parasite. If you take it in a way that in its life cycle, the stage in which it is in, remember science, in primary school there used to be the egg, the larva, then the pupa, and then the adult.
Yes.
It also has a similar stage. It has what we call a larval stage, larva. So if you take it in a stage in which the body's condition, environment has to be conducive enough for it to grow. So you may take the eggs and you will not get the infection.
Okay.
Yeah.
All right. Now, so fine, all those things, you take them, they infected, of course,
Yes.
beef, pork, or fish.
Yeah.
Okay. So how do I know that I am infected?
Good. Now, of course, it always starts with what you feel. Yeah, it just has to start with the symptoms.
Yeah.
The symptoms, of which now people now come, they complain of abdominal pain, and sometimes they have diarrhea. Diarrhea. Rarely will you get vomiting unless they have been so many to cause obstruction of the intestines. Then we have other features like weight loss. Yeah.
You're feeding, but you still have weight loss.
Yeah,
okay.
Weight loss. And suppose they are many or it's long enough now to be 80 meters, which is now forms a huge volume.
Okay.
And what happens is that now the body has reflexes, which now, when now the abdomen is full, it sends signals to the brain that there is food.
Yeah.
The,
They needs to come out.
Yeah, no, there is food in the intestines.
Oh, in the intestines, okay.
So the appetite drops.
Reduces.
So some of them, they'll come with a loss of appetite and weight loss as well, pain in the abdomen, and sometimes, but not commonly, they come with distension of the abdomen. Then from there, of course, with such a history, we now have to do a thorough investigation.
Okay.
Yes.
All right.
Yes.
So we need to take a very short break. But of course, when we come back now, we'll talk about the diagnosis investigation.
Yes.
And then after that, what next? In terms of now, especially for the pork, tapeworm that we said can be really, really, really risky, for most people. So if you have any other question, I can see a number of questions. But if you still have any other question in relation to the same, please call us live or 791-478-990, or better yet, send us a text message on 40925 with your question. And of course, we'll be more than glad to answer your questions as far as tapeworms is concerned. So we'll see you on the other side of the break. Stay with us. All right, welcome back. Glad you're still with us. Thank you very much for choosing to stay with us on My Doctor. Today we are focusing on tapeworms. And like I said earlier on, some of you might be like, oh, really? So tapeworm, what is it about it? But like we said, this has become a major concern, especially for the World Health Organization, where, like we said, in some instances where someone gets infected with the pork tapeworm, of course, might end up causing complications that might be fatal. So it's very, very important for us to understand that. But if you have any other question in relation to the same, our lines are open. So 0791-478-990 is the number to call in, or better yet, send us a text message on 40920 with your question. And of course, we'll be more than glad to answer all your questions as far as tapeworms are concerned. And talking about questions, we have one here, and they're asking, which is the best dewormer? Yeah, I think we'll talk about this early on in treatment, but yeah. All right, and yeah, so stick around for that. Of course, we'll address this as far as the treatments are concerned, because again, like I said, we were discussing this off air, where someone was saying you don't really have to deworm if you are observing hygiene. But then again, Dr. Ari was of the thought that yes, you might observe hygiene at your place, but then again, what if you go outside and eat food from outside? So stick around for that discussion later on. So, but when it comes to the diagnosis, so of course, some of the things that we said, that is pain, a little bit here and there, loss of appetite, loss of weight, and all that. So what happens during the diagnosis?
Now, thank you. When you now go to the hospital, and in this case, you find some people tend to go to hospital when now the symptoms are actually severe enough. You give it time, and then the pain and the swelling and the loss of appetite is not going away. Yeah. What happens is that the doctor will take time now to do a good physical examination. All right. Yeah, after now taking the history, what are the symptoms, and then also they'll have to ask you other questions like, have you have other chronic illnesses before? All right, are you on any medication? And then now after that, they now have to examine you. They're going now to do a general examination. Okay. Whereby now, you find now maybe the patient could be okay. If it's severe, they could be sometimes they are wasted because of the weight loss. Yeah, they are wasted, and then you find if now it has been sucking blood, you find they have signs of anemia. Yeah, you're able now to know that there is anemia. They have what we usually call pallor. And then we now do the examination of the abdomen. All right, and then we want to know, is it swollen? And if it's swollen, can you be able to feel any masses, any swellings? Okay. Yeah, and are they painful? In which location? Because the issue is that if you don't do a thorough examination, you might you might miss out other serious conditions, which we may present the same way. Because some conditions, like those people who have chronic illnesses, some of them you find cases like cancers of the abdomen, TB, chronic infections. They also present with diarrhea, weight loss, and loss of appetite.
Okay.
So you don't want to miss. You don't want to miss. Then after now, you now do a good examination. You can now proceed and now do investigations. Yeah.
Okay. All right. And how long do they take? And especially, I'm really concerned more so for the children, because I mean, of course, the immunity is still developing and all that. So is it more serious, especially for the symptoms, in children as compared to the adults?
Of course, the seriousness of such an infection, it depends on the age. If you find people who we say extremes of age, children and the elderly people, they are more affected. They are more, because now children, number one, their immunity has not yet been strong enough. Yeah, and of course now children, you find they are growing, so they are depending on nutrients on a daily basis.
True.
Adults, of course, there are symptoms, but not as severe as children or as kids.
All right. Okay. And in terms of the presentation of the symptoms, and for the children, especially anemia, can it probably be more fatal for them, and even for the adults? I mean, not adults, but elderly.
Yeah, actually, talking about the elderly, it's even more fatal, because you see, when we grow old, all our organs grow old.
True.
Including now the ones which are responsible for now the manufacture of new blood cells. And also remember, the elderly, most of them have other conditions. Find some of them have diabetes, others have hypertension, others have heart diseases, some could be having other chronic illnesses, things like HIV. So anything which now just slightly distorts what we call the balance, the equilibrium, is going to be quite fatal.
Sure. Okay. All right. Now, before we talk about the treatment of the same, now focusing on the pork tapeworm, which, like we said, is more serious as compared to the others. The others, you might not have really complications, or you might not have symptoms per se. But then again, for especially for the pork, very serious. Now, and you talked about earlier on the fact that there's some people who, for them, when they get infected with the pork tapeworm, they might not really get itself outside the intestines and then find itself into the bloodstream and then go to the other organs. And for some people, it can. So what determines that?
Okay, there are really no specific factors which now determine that this person it is going now. It's a matter of chance, because it's an aggressive parasite. So if it tends now to just break the barrier between the intestines and the blood vessels and the veins, the capillaries, it'll find its way.
Okay.
So few chances it might not.
Okay.
But when it now gets its way into the bloodstream and migrates to the other organs, now it will now start giving you symptoms. Yeah.
Okay. So does that bring about the difference in terms of either it's intestinal or invasive type of infection?
Definitely.
So for the invasive type, so what happens? Like, so how do you know that now these things they've moved from the intestines and now they are in the bloodstreams? Are there symptoms that's
Yes. A very good question. Actually, we would have failed if we never discussed issues on the pork tapeworm. But because now, let's say it goes to the brain like it commonly does, the patient, not only will they come with pain and issues with their digestive system, they will also come complaining, I have headache. Then some of them, they say, I have some blurred vision. It's not clear. I can't see well. Some of them tell you that I get dizziness. Some of them, they have hearing problems. And all this depends on the place in the brain where it's going now to grow at. Some will even have confusion. They'll come, they're confused, they can't know who. Some will come with loss of memory. Some will come with emotional imbalances. So these are symptoms which they'll be able now to tell the clinician, the doctor during the presentation, or maybe a relative. Now, you may not really be able to pinpoint, determine. No, it's a spread to the brain. It's called neurocysticercosis because that thing is called a cysti. It's cystic, of course, cysticacus. So cysticacus. So because other things can cause headaches and loss of vision. So of course, this will now have to now warrant investigations being done. But also back to the history, if a detailed history is taken from you, especially your nutritional history, where there is a high index of suspicion, you find that they may have an idea. Could it be this? And then it spread to the brain.
To the brain,
Suppose they did some basic stool tests. Then they find the eggs and the segments in stool. They could try to translate to say, why the headache and the blurring of vision? So they'll tend now to say, no, let's continue and do more investigation.
Okay. Can it be easily missed? Because I'm thinking, you know, so many other conditions also cause some of the symptoms that we've talked about. There's aspect of headache, confusion, sometimes dizziness, cases of migraines where there's that blurry, you know, vision and all that. So is it easily, can it be easily missed?
Yes. Yes, the answer is yes.
Okay.
Because the symptoms are going to mimic so many other symptoms. And if on our side, as clinicians, we don't do a thorough examination, we'll miss it. And sometimes it's so tricky, such that even if you do a thorough examination and history, you'll still find that you have missed it. Until now you do maybe investigation, maybe the CT scan and the MRI. And remember, of course, if it's done, it has not to be now well interpreted by a seasoned radiologist. Because suppose a scenario where the patient ingests or gets infected in the intestines, and then usually, because maybe it's one or two or just a few, you'll not get symptoms. All right? But that one that now penetrates and goes to the brain, when it goes to the brain and grows, it will definitely cause symptoms, which will be worse than in the abdomen.
System.
So they'll just come with just headaches and the blurring of vision and other symptoms.
All right. And what if it gets itself into other organs? You know, remember we talked about the lungs, the heart. What happens in terms of how, or no, when it gets itself into the other organs of the body? Vital organs.
Vital organs. And you're talking about the lungs, talking about the liver, the kidneys, the heart. Really the spleen. But it can also get there, but now it's very rare. And when it gets there now, it is going now to present in terms of how it has impaired the function of that organ. If it now goes to the lungs, for example, and grows to a size enough to cause chest pain, there's difficulty in breathing, sometimes patient cough, they cough, then maybe the breathing is affected. Of course, they'll come with the symptoms of that system. If it's the liver, of course, it'll come with pain in the abdomen, sometimes yellow eyes. You get the stool color has changed, and there's diarrhea and everything. If it's maybe the other parts. So it's, in a nutshell, it depends with the organ affected. And still, I can assure you that if you're not keen enough to do a thorough history, examination, and investigation, you'll miss it. Yes.
All right. So of course, thorough investigation, you know, needs to be done. All right. And then during my research as well, we also found an aspect of a leaking cyst. let's say if the cyst has ruptured, all right, and then on whatever parts, of the body,
Yes.
and starts to leak, what could that have cause?
Now, if the cyst now happens to leak, okay, which happens in scenarios whereby it can happen, it can rupture on its own, or it can rupture, as you're going to discuss, during removal.
Oh, wow,
Yeah.
okay. If you're not careful, it can rupture
Yeah,
during removal.
it's very soft.
Yeah.
It's super soft. So you just puncture it a little bit and then it ruptures.
It ruptures, uh-huh.
It's going to be quite serious, because the body immediately notes there is a foreign organism. So now the immunity now, is the soldiers of the body
Yes,
now.
try to fight.
Yeah, they're ready to fight.
Yes.
And that fighting, the organism now tends now to be so severe, such that now it overwhelms the body. So the patient can go into a state which we usually call anaphylactic shock. Anaphylaxis to our viewers is when there is now excessive allergic response.
Yeah.
Okay? The immunity reacts to a foreign body, but it now does it excessively. Is excess. So now that overwhelms the body, and it can now make the condition to be worse. And if not managed well, it can be a cause of actually death.
Yeah, it can be really, really serious.
can
And
be
that is why I
lethal.
think today we're emphasizing on the fact that it's
Yes.
very, very important for us to understand all these things.
Yes, definitely.
Okay, so diagnosis done, all the tests and thorough investigations done to ensure that we actually give out a correct diagnosis, as far as if these other symptoms are a sign, as a result rather, of tapeworms or something else. All right.
Yeah.
So is there medication, or then the only thing that is left is just the removal of the tapeworms? What happens after?
Okay, thank you. You're going to allow me in just 30 seconds to insist that the reason why we insist on a thorough evaluation of the patient is because pork tapeworm and beef tapeworm, they are not the most commonest infections. All right. So if you look at their symptoms, you'll find that they are now in conditions which are going not to present more frequently with those symptoms than the beef or the pork tapeworm.
Okay.
And you see, as usually say in our circles, that common things occur more commonly.
True.
So it may be misdiagnosed. Yeah, you may be having tinnitus, as we call it, but and then they are treating maybe for amoeba or some other infection of the abdomen. Now, concerning treatment, it can be treated.
Okay.
There are drugs which are specifically manufactured to kill the tapeworms.
All right.
Yes.
All right. And then, okay, once they're killed, again, when we were younger, back to the reference, we saw them come out. Some came out alive.
Yes.
And others, oh, well, maybe if they were dead, but you can still see the long thing.
Yeah.
So for the medication, does it like sort of squeeze you? People say nakata kata. So you don't really see it like that long.
No, you see now, what happens is that these drugs, they tend to go and interfere with the structure.
Okay.
All right, with the structure of the tapeworm itself. So it might come out dead or having not fully disintegrated. Sometimes you may not see it in stool. Yeah.
Okay.
But the biggest sign of knowing that you're really succeeding in treatment is when now the patient's symptoms they reduce. Yeah.
Okay.
Yeah.
All right. And then we also talked about the removal.
Yes.
Parts of it, which
it used to be interesting in our childhood days, and I don't to describe what we used to see on our colleagues.
It wasn't nice.
At least nowadays we have improved.
Yeah. So of course, the removal again. So what happens? I mean, just because for the medication, yes, you might not really see it, and that is like the current medication that is being issued.
Yeah,
all right. So you might not really see it. Yeah. So after how long is a person supposed to be on medication?
Now, as you discuss, if you find it will cause different symptoms. And if you just have the abdominal infections, you find that you have to do like from 2 weeks continuing to continue, so that you are now sure that it's fully eradicated.
Okay.
For patients who now need to, they have, it has spread to the other parts of the body, you'll find that you are taking the drugs, but as you said, it forms a cyst. A cyst. A cyst is like a bag with fluid, a soft bag with fluid and very many organisms inside there. So even if you take drugs by mouth, they will not be able not to penetrate inside. So it will keep growing.
Okay.
It will keep growing. So another form of treatment apart from drugs, I know we have quite a lot, but like in our setting we have what we call niclosamide, and also we have another one called praziquantel. Some of them now you now have to now involve the surgeons. Yeah. If it's in the liver, you have now to involve now the general surgeons and the liver surgeons. If it's in the brain, of course, you have now to get the intervention of a neurosurgeon.
Yeah.
You just have to. Because however much you may try to give oral medications, they will not work. It will be an exercise in futility.
Yeah.
So they have to come and manually and surgically, they remove it.
Okay.
They remove.
All
Yeah.
right. But suppose if they're like so many in number, they'll still have to remove all of them.
Yes, you see, now the problem is that I'm talking about brain because it's the most commonest and the most lethal part where the pork tapeworm spreads.
Yeah.
Brain is a very limited space. And already right now, our skull, and our skull is already occupied by the brain and the fluid and blood. So anything which tries to intrude into that space is going to affect the functions of the brain, and the brain controls the rest of the body.
Okay.
So if it now causes, maybe for example, goes to a place where it now causes the increased pressure like that, and then that is where the system that controls the breathing and how the heart beats is in the brain. So what happens is a breathing problem.
Yes.
And of course, there is now the issues with the heart beating. So that itself can cause death. That is why even if there are three, the neurosurgeon will see
Yeah.
what is the best approach.
Yeah.
But they just have to be to be assessed.
Yeah.
Because sometimes you look at the risk and the benefit.
Yeah.
Yeah, sometimes the cyst might be in a place where by now to get it
It's difficult.
is difficult.
Yeah.
And it's a nightmare.
Yeah.
It's a nightmare.
For the neurosurgeons.
Yes.
Okay, so it's very important, I mean, to again, because like we said, sometimes it can be missed, so thorough investigation needs to be done, and then to avoid just late, diagnosis, which, like we said, it can be really fatal and end up causing death. It's something that, if found earlier, it might be averted.
Yes.
So suppose that someone seeks treatment, earlier, and let's say the infection had gone to the brain and on any other part of the organ, if they are removed, so a person goes back to normal, everything becomes okay, or they would have like some sort of side effects to the same.
Now, if the symptoms were not severe, meaning that the severity of the infection was not as bad, patients usually go back to the daily routine and daily activities and normal function. Now, if it's severe enough to be maybe at the liver, to be at the brain, it's unknown. It will depend with how big and the location. And whether the removal will be successful.
Okay.
And whether the treatment also will be successful.
All right.
Because if it's in a place where by now in the brain, it's a very tricky place, because
very tricky.
if it causes pressure and the brain cells in that area, they die, they don't regenerate. So it will be like someone who suffers a stroke and then they are trying to recover.
Yeah.
So sometimes they have some symptoms which persist even after treatment. Yeah, but now I'm talking about now the severest of the cases now. They persist even after you treat. The patient did not die, which is a good thing anyway.
Yeah.
But sometimes they have some complications which persist in life. You might find the walking is difficult. It's difficult walking. They are limping. Sometimes you find they get the talking. The vision sometimes is affected. So It depends. It depends.
Okay. All right. So most important is diagnosis, early diagnosis.
Early
That is
diagnosis,
it, and don't take it
early
for granted.
diagnosis
Okay.
and early treatment.
Yes. Yeah, both of them go hand in hand. Okay.
Yes.
So we need to end the show like right now. But in your parting shot, what would you say in terms of preventive and home remedies? Very, very briefly. And as we wind up.
Thank you very much. As we say always, prevention is better than cure. And you see, nowadays we have so many areas where people take pork and they go and take nyama choma, they buy beef. Always make sure that you cook your food well.
Yeah.
Make sure your meat is thoroughly cooked. It's thoroughly roasted. If it's boiling, if it's frying, it's well fried. To minimize the risk of the infection. And of course now a public health concern is that let us ensure that our animals are well checked by our vets, they're given the right treatment, and always ensure, like maybe you're a butcher, you deal with meat, ensure that your meat is always inspected, because you don't want to buy a meat which is now going to be sold to your customers and then they now come to us with such symptoms.
Yeah.
So it's the whole community at large can help us to minimize the cases of tapeworm infection.
All right. Thank you very much, Dr. John. That is such a perfect way to end the show. So thank you so much for coming by today. And I'm pretty sure now we have a changed perspective as far as tapeworms are concerned. Because when we started the show, we were like, oh, well, tapeworms. But of course, by the end of the show, we understand how fatal, yes, it can be if you do not take proper measures as far as prevention is concerned. And one of them, from what Dr. has said, is ensure that you observe proper hygiene at home or wherever you are. So my name is Winnie Lubembe. On behalf of the entire team who made the show a success, we wish you a lovely day ahead. We'll see you again tomorrow on My Doctor for another dose. But for now, have yourselves a lovely day ahead. Goodbye.